All right, so we're going to go forward. The table's going to do all the work.
Okay.
There we go.
So do you want me to put my hands by the side?
Yeah, so hands at your sides. And we're going to do the leg check here and look for that pinch nerve reflex or that nerve irritation reflex. Do an adjustment to your knee and your ankle because the reflex is on the right side. We'll put a little pressure on the hips. Hips stay even in this case, so that's a good thing. That means your hips are lined up at the moment. Now we're going to stress the pelvis, kind of push it to the right or the left. And again, feet stay even, so that pinch nerve reflex did not come back. Squeeze your knees together. Relax. Now that made your right leg get short, so that tells me I need to adjust this ilium. Now your feet are even. Squeeze your knees again. Relax. Feet stay even, so that means the little thumper here, the arthro-stim, actually pushed the pelvis back into more normal alignment. Put your right hand behind your back. Okay, when you move, you put pressure on bones and nerves. If the bones are lined up, nothing happens. But if the bone is irritating the nerve or a subluxation like this one, then when you move, it makes this reflex come back. So your leg tightened up in this case, and your right leg got about 1 inch short. So now after the adjustment with the arthro-stim, your feet are even, so the reflex went away. So the nerve pressure is relieved. Arm down, left hand behind your back. Going to stretch the feet. That's going to tug on the spinal cord just to give a little extra stress, but nothing happens, so that's normal. We're going to check it up here in position 2. Your feet stay even, so that's normal. So that means this segment we're checking is okay. Arm down. 2 hands behind your back. Hands down. And we have a bunch of movements designed to trigger each vertebra as we go up the spine. Right hand above your head. Put it down. Both hands above your head. Now when you put both hands above your head this time, your right leg got about 1 inch short. That's a positive reflex for a lower thoracic, T8 in this case, that has that's subluxated or has nervous system interference. Arm down. Now after the adjustment, the reflex went away and your feet are even. Turn your head to the right. Leave it there until I tell you. Lift the right shoulder off the table. Put it down. Shrug both shoulders. Relax. Right hand above your head. This is for the upper thoracics now because the head is turned. Arm down. Your feet are even, so this is all good. Face in the middle. Now when you turned your head back in the middle, your leg got short. So that's a positive reflex for your lower cervical or C7. So we adjusted it again with the arthro-stim. And if we did our job, the reflex went away, which it did, so your feet are even now. So that's how I know this little thumper actually did something. Look up, head down, tuck your chin to your chest, relax. The leg got short again. Now we're way up here by your atlas. The atlas is the first bone in the spine. That's the one your brain sits on. Usually when I adjust newborn babies, that's the only bone I usually ever have to adjust because the rest of the bones are kind of rubbery and fluid, so they don't get stuck. But that first bone in a little baby gets stuck a lot of times during the birth process and can plague us for our entire life. Tuck your chin again. Relax. We're going to recheck. Now when you tuck your chin, your feet stay even. So again, that pressure on the atlas is relaxed. Push your face in the paper. Relax. That's your occiput of your skull. That stayed even. That's good. We're going to check your TMJ. Bite down in your teeth. Open your mouth. Slide your lower teeth sideways to the right, sideways to the left. Now when you slid your jaw sideways to the left, your leg got short, so even your jaw can set off this reflex. So that's a lateral TMJ adjustment I just did. And your feet are even, so slide your teeth to the right, normal, slide your teeth to the left. Now when you do that, your feet stay even, so I know the pressure on the TMJ is better. I want you to jut your chin straight out so the lower teeth go out past the upper. Pull your chin backwards and smile like you're saying the letter E. Got short again. It's going to tell me which side. And it's also on the left. turn your head to the left for me a little bit. Good. That's a posterior TMJ. Face in the middle. Wonderful. Pull your chin backwards and smile again, like you're saying letter E. Relax. Now your feet stay even. They stay even in position 2, so everybody's happy. And I still go through with my hands. I want to palpate and feel the motion of the spinal segments. And they should have a nice light bounce to them. Palpate the neck. Again, I'm looking for a little give. If anything's poking out a little bit more than I think it should, I'm going to use the arthrostem to come in here and adjust. That's your C2. And now that little prominence I felt before is better. So that means it's back in alignment. Excellent. And that's an adjustment. Thank you.